Good morning, and welcome to all of you for coming out to the Black Men's Health Summit again this year. It is so wonderful seeing your lovely face. And again, congratulations to Dr. Angela Adams for such a wonderful job that she pulls this thing off every year for us to keep us healthy in America. Today, I'm going to give you an update on where we're standing with the very controversial subject of should we all do PSAs, and who should have a PSA, and when should we stop getting PSAs. For a moment, take a look at this chart that I'm going to show you, and look carefully. You remember last year, the controversial PSA mandates came out from the United States Task Force on Preventive Health. And we were very concerned about that because it affected us as a race of minority men. Because simply it said that we didn't have to do early detection and early screening because the statistics were showing them that it was not leading to changing the mortality or deaths in our community. Well, if you look at the chart, it says do not screen men that are less than 40 years of age, and do not screen men ages 40 to 55 years of age. Individualize those for risk factors. That is, I would assume if you're Afro-American, high family risk, say a first-degree relative like your father or even your brother having prostate cancer, or if you're having abnormal PSAs that are greater than 2.5, then that would be an indication. For those ages 55 to 69 years of age, use shared decision making. That is, you want to talk to your doctor to understand what risk are you taking on before you undergo the PSA. Because understanding PSA is not a 100% predictor of having prostate cancer. We have failed as a race to show collateral data that will support using PSAs at an earlier age. For instance, we've seen through the summit men that have been 36 diagnosed with prostate cancer. But the caveat to that is if we look at men that have died from auto accidents and we do autopsies on their prostates, say from 25 to 40, we will find foci of prostate cancer present in that prostate, which would not be a harmful disease. So the other point is, when do we continue to screen? If you have a negative digital rectal examination and your PSA is less than 2.5, then it's recommended that you should screen every 2 years and not once a year. And the cutoff they're recommending by the American Urology Association is that we should not screen beyond age 70. So if you're at 70 and above and you're scheduled for the screening today, then you may want to think twice as to what would it benefit you to undergo the screening. Let someone who's at risk take that slot so that they can be diagnosed early and get treatment as properly diagnosed and worked up by their urologist. Now, what I'd like to talk about again is the fact that what is causing this big trend and the change. Well, if you look around the room and you see who's present, if I was to say by show of hand, if you're a diabetic, raise your hand. Now, fellas, look around the room at all the diabetics. If you have a diagnosis of hypertension, now you raise your hands. Let's look at the hypertensive males. We just saw the diabetic males. Now, if you're taking medications such as a statin to control your cholesterol, let's see what your hand looks like. Raise your hand. Now, if your scale tips over and shows that you are morbidly obese, would you be so kind to raise your hand? Or are there anybody raising their hand? Well, I didn't think anybody would raise their hand on that one, but the issue is we are now met with a new beast called metabolic syndrome. Metabolic syndrome is the factor for which is killing most Americans, especially Afro-Americans. With metabolic syndrome, you're at risk for heart attacks, strokes, renal disease, and get this, guys, you're at a very increased risk of impotence. Who wants to lose their ability to have normal erections? And this is the task that we're now forced to look at. Because if we have men that are metabolically unstable and not balanced, they're going to be at increased risk of prostate cancer. A study was shown that says that if you have a BMI, your metabolic index is greater than 30, you're obese, diabetic, uncontrolled, hypertensive, guess what? If you have an elevated PSA, chances are you're going to have a very high-grade disease that is very difficult to treat. And that is the problem. This is where we need to start looking. How do we treat and balance the man so that you don't get these deadly diseases? And the other aspect with metabolic syndrome is controlling sugar. Look at the table and look at who ate most of the bread this morning, because bread leads to sugar. Sugar leads to oxidation. Oxidation leads to inflammation that causes cancer. These are the concepts that we're looking at as doctors and scientists on how do we prevent diseases. The Obama healthcare program is now strongly looking at the data as to how can we create healthcare plans for preventable deaths. Even though we have been working very hard in the summit to look at prostate cancer, and I would think we've done a very great job looking at it, and the fact of the matter is now we need to save lives about teaching proper dieting, lifestyle changes, and modifications in our cultural things that have caused us to develop metabolic syndrome. You know of people that die readily from heart attacks, from having strokes, more so than people that die from prostate cancer. So the issue is, if we can change metabolic syndrome and now balance men and look at testosterone, your male hormone, then maybe we can prevent these deaths that are occurring from prostate cancer. The trick here and the caveat and take-home point is, if you look at 7 men out of 1,000 that died from lung cancer, screening only gave us 1 man out of 1,000, in essence, who basically died from prostate cancer, and it wasn't changed by even 1 other person. So the dilemma is, if we're going to screen, we have to show statistics that we are actually saving lives. My message to you, how do we save lives? Let's look at the mouth. The food can be medicine, and medicine can be food. So we need to look at that philosophy and change how we live. Thank you, and have a wonderful day.